This medication is called Falmina and it is used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, Falmina can also make periods more regular, decrease blood loss and painful periods, decrease the risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect against sexually transmitted diseases. The daily dosage is typically 1 pill per day, and it is best to take it at the same time every day for optimal effectiveness. Before you start taking Falmina, be sure to read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take Falmina by mouth as directed by your doctor, usually once daily. It's best to pick a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. Be sure to follow the manufacturer's directions for your specific brand. Continue taking Falmina exactly as prescribed by your doctor. It's important to follow the package instructions to find the first tablet. Start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. If you experience vomiting or diarrhea, you may need to use a backup birth control method, such as condoms or spermicide. Consult the patient information leaflet or your doctor for more details. Taking Falmina after your evening meal or at bedtime may help if you have stomach upset or nausea. You may also choose to take it at another time of day that is easier for you to remember. No matter what dosing schedule you use, it is very important that you take this medication at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication. Take one active pill, with hormones, once daily for 21 days in a row. If you are using a product with 28 tablets, take an inactive pill once daily for 7 days in a row after you have taken the last active pill. If you are using a product with 21 tablets, do not take any tablets for 7 days. You should have your period during the 4th week of the cycle. After you have taken the last inactive tablet in the pack or gone 7 days without taking an active tablet, start a new pack the next day whether or not you have your period. If you do not get your period, consult your doctor. If this is the first time you are using Falmina and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking Falmina on that day. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ask your doctor or pharmacist about how to switch from other forms of hormonal birth control to Falmina. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Side effects of Falmina may include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects last or get worse, tell your doctor or pharmacist promptly. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, contact your doctor for a pregnancy test. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. This medication may raise your blood pressure, so it's important to check your blood pressure regularly and tell your doctor if the results are high. Tell your doctor right away if you have any serious side effects, including lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing eyes/skin. This medication may rarely cause serious problems from blood clots. Get medical help right away if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath, unusual headaches, unusual sweating, weakness on one side of the body, or vision problems/changes. A very serious allergic reaction to this drug is rare, but seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice other effects not listed above, contact your doctor or pharmacist. If you're over 35 and smoke, Falmina may not be the best option for you. Smoking while taking Falmina can increase your risk of serious health problems like stroke, heart attack, blood clots, and high blood pressure. It's important to avoid smoking or using tobacco while using this medication. Before taking Falmina, it's important to let your doctor or pharmacist know if you are allergic to any estrogens or progestins, or if you have any other allergies. This medication may also contain inactive ingredients that could cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have a history of blood clots, high blood pressure, abnormal breast exams, cancer, high cholesterol, depression, diabetes, gallbladder problems, heart problems, kidney disease, liver disease, obesity, stroke, thyroid problems, or unexplained vaginal bleeding. If you have diabetes, it's important to monitor your blood sugar regularly and inform your doctor of any changes. If you have diabetes, phenylketonuria, or any other condition that requires you to limit or avoid sugar and aspartame, caution is advised when taking chewable tablets. If you are planning to have surgery, it's important to inform your doctor, as you may need to stop taking this medication for a period of time or take special precautions. It's important to limit your time in the sun and avoid tanning booths and sun lamps while taking Falmina, as it may cause blotchy, dark areas on your face and skin. If you are nearsighted or wear contact lenses, you may also experience vision problems or trouble wearing your contact lenses, so it's important to contact your eye doctor if these issues occur. It may take longer for you to become pregnant after stopping Falmina, so it's important to consult your doctor if you are planning to become pregnant. This medication should not be used during pregnancy, and if you become pregnant while taking it, it's important to inform your doctor right away. Finally, Falmina may decrease breast milk production and pass into breast milk, so it's important to consult your doctor before breastfeeding while taking this medication. When taking Falmina, it's important to be aware of potential drug interactions. Some medications, such as aromatase inhibitors, fezolinetant, and tamoxifen, may interact with Falmina, affecting its effectiveness. Additionally, drugs like griseofulvin, modafinil, and St. John's wort may cause hormonal birth control to work less effectively, increasing the risk of pregnancy. It's important to communicate with your doctor when starting any new medication and to discuss the potential need for additional birth control. Furthermore, Falmina may interfere with certain lab tests, so it's crucial to inform lab personnel and all your doctors about your use of this medication. If you or someone you know has overdosed on Falmina and is experiencing serious symptoms like passing out or trouble breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, while Canadian residents can call their provincial Poison Control Center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's crucial to act quickly in these situations to ensure the best possible outcome. Remember to always keep Falmina out of reach of children and pets to prevent accidental ingestion. It's important not to share this medication with others. While taking Falmina, it's essential to have regular complete physical exams, including lab and/or medical tests such as blood pressure, breast exam, pelvic exam, and pap smear. Make sure to follow your doctor's instructions for examining your breasts and report any lumps right away. It's crucial to keep all medical and lab appointments and consult your doctor for more details. If you miss a dose of Falmina, make sure to refer to the product package information for advice on what to do next. It's important to use backup birth control, like condoms or spermicide, to prevent pregnancy if you miss a dose. If you have any questions, be sure to ask your doctor or pharmacist. If you find that you often forget to take your pills as directed, it's a good idea to talk to your doctor about possibly switching to a different form of birth control. When storing Falmina, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place that's out of reach of children and pets. When it comes to disposing of Falmina, don't flush it down the toilet or pour it into a drain unless you're specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or you no longer need it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.